Hi, my name is Adam Kuehn. I am Senior Medical Director at Lifebank and Celularity, and I've been with the company for around 2 years now. In our 20-plus years in business, we've released approximately 100 units for infusion, and those units have been used by doctors to treat a variety of different diseases and disorders. Excellent question. Our data shows that over the last 20 years, the diseases being treated with released units have changed over time. For the first 15 years or so, our units were released to physicians to treat mostly blood cancers and rare genetic conditions. A lot of the units were used to treat the siblings of the children whose stem cells had been stored. Then I'd say a big shift happened a few years ago, where now almost all units that are being requested and released are being used to treat children suffering from neurologic disorders, such as autism and cerebral palsy. And interestingly enough, these units are mostly being used for the children whose stem cells are stored, rather than for the sibling or close family member, as was the case when units were being used to treat blood cancers and rare genetic conditions. So the main reason I'd recommend that families bank their child's stem cells is that they are being studied in clinical trials as a potential treatment for neurologic disorders like autism and cerebral palsy. These therapies are currently experimental, but there's been a lot of good clinical data coming out of academic institutions supporting the use of stem cells for these neurologic disorders. And disorders like autism are much more prevalent than the 80 or so diseases that doctors are treating with these stem cells. So there's an opportunity to use these stem cell units in a fashion that wasn't originally expected, but for an indication which is probably more pressing for today's population. Overall, we want to assist as many families as we can that are affected by these disorders, and banking their newborn stem cells could be a great way for new parents to help their children, should they be affected by some of these disorders.